Imagine this. It's a quiet Tuesday morning. You're sitting at your kitchen table with a cup of coffee. The mail just arrived. You open a thick envelope from your Medicare Advantage plan, and your heart sinks. Your dental coverage cap has been cut in half. Your over-the-counter card allowance is smaller. Your specialist copay just went up. And the doctor you've trusted for 15 years is no longer in your network. You feel your stomach drop. You wonder, how did this happen? Nobody warned me. I didn't change anything. Why is my plan suddenly different? If you're a senior on Medicare Advantage, this scenario is not a fantasy. For thousands of retirees across America right now, in 2026, this is happening at kitchen tables just like yours. And here's the painful truth. Most seniors never read the one document that could have warned them months in advance. My name is Edward. I'm a senior policy analyst, and I've spent years helping retirees decode the fine print that insurance companies and government agencies bury in pages of legal language. Today, I'm going to walk you through exactly what's changing in Medicare Advantage in 2026, the dangerous mistake most seniors are making right now, and the 3 exact steps you must take to protect your coverage, your wallet, and your peace of mind. Stay with me until the very end, because there is one hidden mistake I see seniors make over and over again, a mistake that locks them into the wrong plan for an entire year. I'll show you how to avoid it. Let me tell you about Robert. Robert is 71 years old. He lives in Ohio. He's been retired for 6 years, and he's on a fixed income, Social Security, and a small pension. Robert is the kind of man who pays his bills on time, keeps his receipts in a shoebox, and trusts the system to do right by him. In 2025, Robert was enrolled in a popular Medicare Advantage plan. He loved it. $0 monthly premium. A flex card that gave him about $60 a month for over-the-counter items like vitamins and bandages. Free transportation to his cardiologist. And a dental benefit that covered cleanings and a partial crown the year before. In September of 2025, Robert received a thick envelope from his plan. It was the Annual Notice of Change, the ANOC. He glanced at it, saw the words, "Your premium remains $0," and put it on the counter. A week later, it went into the recycle bin. January 1st, 2026 arrived. Robert went to the pharmacy to use his OTC card. The cashier told him the balance was lower than expected. Robert thought it was a glitch. A few weeks later, he went to the dentist for a crown. The office told him his annual dental maximum had been reduced. He would owe nearly $800 out of pocket. Then, in February, Robert called to schedule a ride to his cardiologist. The transportation benefit had been dropped from his plan entirely. Robert sat down and did the math. Between the lost OTC dollars, the reduced dental cap, the new specialist copays, and the cost of paying for rides himself, he was going to be out nearly $2,000 over the course of 2026. He called his plan. He was polite, he was upset, but the answer was the same. "Sir, these changes were disclosed in your annual notice of change last September. The Medicare open enrollment period ended December 7th. You can switch plans during the Medicare Advantage open enrollment from January 1st to March 31st, but after that, you're locked in for the year." Robert made one small mistake. He didn't read the ANOC, and that single mistake cost him thousands of dollars. Now let me explain what's actually happening in 2026 in plain English, so this doesn't happen to you. Here's the good news first. According to the Centers for Medicare and Medicaid Services, the average Medicare Advantage premium is actually going down in 2026 from $16.40 a month to $14. About 2/3 of Medicare Advantage drug plans still charge $0 in premium beyond the standard Part B premium, which is $202.90 a month in 2026. So if anyone tells you premiums are doubling across the board, that's not what the official data shows. But here's where it gets serious. The premium is just one number. The real changes are hiding inside your plan's benefits. According to the Kaiser Family Foundation's 2026 analysis of Medicare Advantage, the share of plans offering an over-the-counter allowance dropped from 73% to 66%. Meal benefits dropped from 65% to 57%. Transportation for medical needs dropped from 30% to just 24%. Remote access technology benefits dropped from 53% to 48%. Now, dental, vision, and hearing benefits are still offered by 98 to 99% of plans. That sounds reassuring. But here's the trap. Even when a plan still offers dental coverage, it can quietly reduce the annual dollar cap, raise your copays, or shrink the list of covered procedures. Your plan still says dental included, but the actual dollars you get may be cut significantly. There's more. On January 1st, 2026, the federal government ended a special program called the Value-Based Insurance Design Model, or VBID. Around 7 million low-income Medicare Advantage enrollees, including many people who are dual eligible for Medicare and Medicaid, were receiving extra benefits like food assistance, transportation, and reduced drug costs through this pilot. As of January, those tailored benefits are gone for affected plans, and the Part D out-of-pocket cap is rising from $2,000 to $2,100 in 2026. The maximum Part D deductible is now $615. So while the headlines may exaggerate, the truth is this. Real cuts are happening to real benefits. And if you don't know where to look, you'll only find out at the pharmacy counter or the dentist's office. Now let me give you the 3 exact steps you must take, starting today. Step 1. Read your annual notice of change, every single page. Every Medicare Advantage and Part D plan is required by federal law to mail you the ANOC by September 30th each year. This document lists every single change to your costs, your benefits, your drug formulary, and your provider network. Don't just look at the premium. Look at the specialist copay, the hospital per day charge, the maximum out-of-pocket limit, the dental annual maximum, the OTC monthly allowance, the drug tier of every medication you take. If you've already thrown yours away, call your plan and request a replacement copy or download it from your plan's member portal. Do this today. Step 2. Use the official Medicare Plan Finder at medicare.gov to compare your 2026 plan against other plans in your zip code. This is the only government-run, unbiased tool. For 2026, Medicare added a new feature that shows whether your specific doctors are in each plan's network. Type in your doctors. Type in your prescriptions. Type in your pharmacy. Compare apples to apples. And if you need free help, call 1-800-MEDICARE or contact your local state health insurance assistance program, known as SHIP. These counselors are federally funded, completely free, and they do not sell insurance. They work for you. Step 3. Know your enrollment windows and your appeal rights. The Medicare open enrollment period runs October 15th through December 7th every year. That is your main window to switch plans. But there's a second window most seniors forget, the Medicare Advantage open enrollment period, which runs January 1st through March 31st. During those 3 months, if you're already in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan once or return to original Medicare. After March 31st, you are generally locked in until the next fall, unless you qualify for a special enrollment period, like if you move, lose other coverage, or qualify for low-income assistance. And here is something special for 2026 only. Because Medicare added provider directories to the Plan Finder for the first time this year, if you relied on incorrect provider information in your first 3 months on a new plan, you may qualify for a special enrollment period to switch. Call 1-800-MEDICARE and ask about it directly. Also remember, If a benefit is denied, you have the right to appeal. You can file a coverage determination with your plan. If they deny you, you can escalate to an independent review entity and then to an administrative law judge. Never accept the first no as the final answer. Now, the hidden mistake I promised I'd reveal at the end. Here it is. The biggest mistake I see seniors make is assuming that because their monthly premium is still $0, nothing has changed in their plan. They see zero premium on the first page of the ANOC, breathe a sigh of relief, and stop reading. That is the trap. A plan can keep a $0 premium while cutting your dental cap in half, doubling your specialist copay, removing your favorite hospital from the network, moving your blood pressure medication to a higher tier, and shrinking your OTC card. Zero premium does not mean zero changes. It almost never does. Read every page, compare every benefit, verify every doctor. Do it before December 7th because once that window closes, your options shrink dramatically. Friends, I want you to hear me clearly. The system isn't designed to warn you loudly. It's designed to disclose quietly, in fine print, in thick envelopes, in legal language. The companies are following the rules, but the rules favor the people who pay attention. And too many seniors are not being told where to look. That's why you cannot rely on YouTube notifications alone. YouTube doesn't always show you my videos when new alerts come out. Medicare rules change, Social Security rules change, bank regulations change, insurance policies change, airport travel rules change, and by the time you hear about it through the grapevine, the deadline may have already passed. So here's what I want you to do right now. Click the link in the description below and join the Global Senior Alerts official WhatsApp channel. When you join, you'll receive a free download of our Senior Benefits Protection Guide, a step-by-step booklet that walks you through how to protect your Social Security, your Medicare, your pension, your bank accounts, and your travel rights. You'll also receive real-time alerts the moment a new rule, deadline, or policy change is announced. No fluff, no spam, just the alerts that protect your money and your benefits. Don't wait until you're sitting at your kitchen table with a letter that breaks your heart. Join the channel today, download the guide, share this video with another senior who needs to hear it. This is Edward with RetireRight Decoded. Stay informed, stay protected, and I'll see you in the next video.